According to Dr. Desmond Nicholson, there are many countermeasures to protect against COVID-19 in Region 5. Details in this report.
The Region 5 Department of Public Health has taken public health countermeasures to stop the transmission of the coronavirus. These measures also ensure that the healthcare system does not become overwhelmed by a surge of COVID-19 positive patients, and it also buys time for the development of medical countermeasures to fight against the virus. Regional Health Officer of Region 5, Dr. Desmond Nicholson, shared the first measure that was implemented.
Surveillance is the backbone of public health. Our strategies include early screening, rapid diagnosis and reporting, case management reporting, contact investigations, and the monitoring of trends. To this end, we are involved in robust surveillance reporting and follow-up of each case of acute respiratory illness from all health institutions. This is done through the Regional Health Emergency Operations Center Surveillance Team, which shares its data with the Department of Epidemiology of the Ministry of Public Health and the Health Emergency Operations Center on a daily basis.
The next measure is the setup of COVID-19 checkpoints within the region.
3 checkpoints have been established to screen persons entering the regions from regions 4 and 6. All commuters are screened for elevated body temperatures. This allows for efficient screening, early isolation, diagnosis, and treatment of COVID-19 positive patients.
An institutional quarantine center and an institutional isolation center were set up in Region 5 to accommodate patients who are suspected to have the coronavirus.
We have established a quarantine facility at the Experiment Health Center. It has a capacity of 22 beds and allows us to safely quarantine those residents who have been exposed to COVID-19. These patients will be monitored daily by our team of medical professionals who will provide the highest level of medical care to all patients at the facility. Separate wards of the Maikoni Hospital have been designated for the isolation and proper management of COVID-19 positive patients.
Dr. Nicholson then spoke about testing residents for the coronavirus.
Efficient laboratory practices for sample taking and testing. Currently, 6 staff have been trained in sample taking. Testing is done at the National Reference Laboratory, and the turnaround time for results is 24 hours.
In conclusion, Dr. Nicholson is reminding members of the public to follow the COVID-19 guidelines.
The department continues to advocate social distancing of at least 6 feet between residents. Frequent hand washing is encouraged. There has been installation of hand washing stations at all health facilities, offices, businesses, and other places where it is observed that residents congregate. There is also bi-weekly sanitization of markets, health institutions, and public offices. Each resident is advised to use a face mask in public, especially when social distancing cannot be achieved successfully.
If you are experiencing any of the COVID-19 symptoms, please call the hotline numbers.
Do not forget to call our hotline numbers in the event that you suspect you may have COVID-19 or may have been exposed to COVID-19. These numbers are 624-2000, 624-9000, and 640-3000. Finally, staff must comply with the highest standard in precautions, especially in hygiene practices, and are provided with adequate supplies of personal protective equipment to protect them from becoming infected with COVID-19.
Narima Ali, Channel 8 News.